Hello students. Now this is on the topic of nootropics or cognition enhancer. Before going to the topic, I want to discuss about what is cognition. Cognition is the intellectual process through which information is obtained, transformed, stored and retrieved, also used. Cognition is an active process that is for better or worse affected by our cognitive abilities or skill. Cognition basic unit is concept. Now, what is nootropics or cognitive enhancer? Nootropics are that type of drugs which supplements or a kind of supplements which may improve cognitive function, particularly executive function like memory, creativity, or motivation in healthy individuals. It encompasses processes such as knowledge, attention, memory, working memory, judgment and evaluation, reasoning and computation, problem solving and decision making, comprehension and production of language. So, from this definition, we uh, all can understand what is nootropics means. Now, what are the indication of this drug? This kind of drug may be used in case of Alzheimer disease, multi-infarct dementia, mild cognitive impairment, learning defects, and uh, we have just told that before in the CNS stimulant also. This nootropic also act on attention deficit hyperactivity disorder in case of children. Next is different different kinds of cerebrovascular accident like stroke in case of organic psycho syndromes, sequel of head injury in case of brain surgery also. So what are the mechanism of nootropics? It increase global or regional blood flow and direct support create a direct support of neuronal metabolism. It also enhance neurotransmission process and improve the discrete cerebral function. Now, what are the drugs which are being used as nootropics? Cholinergic activators. So, we can use cholinergic activators like angiotensin converting enzyme that can cross blood-brain barrier are preferred, like tacrine, which have a longer acting reversible angiotensin converting enzyme process, which also palliative for mild to moderate Alzheimer disease, which are also orally active and improves memory, cognition, well-being facilities by acetylcholine release. The adverse effect of tacrine is hepatotoxicity. Next is donepezil, rivaroxaban, and galantamine. Newer reversible anticholinesterase, better penetration to CNS, better tolerable and less toxic than tacrine. It is clinical result modest and temporary. The dosage of donepezil is 5 mg once per day orally, which may be increased by day by day. maximum 10 milligram after 4 weeks. Now, rivastigmine, which first time uh, given 1.5 mg orally, then increased to 3 milligram after 2 weeks of use. Next, galantamine, which may be used 4 mg orally, uh, orally by this in dye, means uh, twice a day, which may increase to 8 mg twice a day after 2 weeks use. Next type of drugs are acetyl L-carnitine, structural analog of acetylcholine, and which may decrease the sign and symptoms of dementia in Alzheimer's disease. It may increase cholinergic transmission, also have an antioxidant properties. So it may slow progression of Alzheimer's disease. Next is memantine, which is a excitotoxicity due to enhanced glutamate transmission via NMDA receptor. The dose of memantine is 5 milligram once in a day, slowly increase to 10 to 20 mg per day. It is non-comparative antagonist of NMDA receptor. It has a better tolerable and less toxic characteristics. Now, what are those miscellaneous drugs used as nootropics? Piracetamab, piracetam, and anirectam, which may use high doses of vitamin E. And there are several antioxidants like vitamin C, A, zinc, and bioflavonoids, which may decrease progression even in middle age of Alzheimer's disease and improve the cognition process.